Here we go.
To do a demonstration of the usefulness of a comorbidity program which searches multiple screens and values, laboratory values, radiology reports, vital signs, oxygen levels, weight and height, EKG findings, to gather significant comorbidities and bring to the attention of the treating clinician for validation and incorporation in the record. Our first patient.
So what Dr. Henry just did is you saw in front of you a patient list. He chose a patient that was important, and what we're looking at is the Cerner record. From here, Dr. Henry will take us through the documentation and bring us down to a tab, and maybe you can see this with my pointer, the comorbidity tab. That actually launches the Retrieve software, and we will be able to see that in action. So let me let Dr. Henry continue for a moment, and I will stop it again.
Is a person with some chest pain. We're getting ready to close out the record with the diagnosis and disposition. We search the comorbidities, and we find that the person had.
So Dr. Henry, press the comorbidity tab, and what you see in front of you is actually the software. And this software has identified that there are some key comorbidities that may be important to document. It's entirely up to the physician whether he or she wants to incorporate this in their electronic medical record. So you see that there's an electrolyte abnormality, there's hypertension, and as we go further down, there's other comorbidities with the EKG, which we'll talk about in a moment. Under hypernatremia, since we're hovering over that, you see on the right the rules that are used to define hypernatremia. These are programmable based on your institution and your normal lab values. So here the sodium is 147 on the chart. And we see that the reference range is 135 to 146. So this level is high. If the physician agrees, he or she can click on hypernatremia, and you'll see Dr. Henry do the same. We will then go down to hypertension and identify that there is hypertension based on the rules, and you'll see Dr. Henry choose that. I will stop us again before we get to the EKG to explain exactly what you're going to see there. Let's go back to Dr. Henry.
So elevated sodium, we can document an electrolyte abnormality, has a history of hypertension, and indeed is hypertensive on one value here. On the EKG records.
So when we hover over the word myocardial infarction, what you see is the report that is currently on the Muse system, which is the documentation system that they use for their EKGs. And a certain word is highlighted. That word is infarct, because that's what it saw in the documentation that was on the record. And now Dr. Henry will evaluate that to see if he wants to include myocardial infarction in the record. He will then do the same thing with first degree AV block, and he'll want to validate that indeed there's a first degree AV block. And what's so amazing here is you'll see the interface between the Retrieve software and the Muse system to see the EKG.
We note that there was a myocardial infarction present previously, but not present currently. But there is a first degree heart block on one of the readings of the EKG, and with the ability to link right to the EKG waveform, the physician can validate that again personally, and indeed sees a first degree heart block, agrees with it, and is going to include that in the comorbidity report. We commit the comorbidities to the record. We go back into our documentation, and when we get to the point where we are going to enter The comorbidities, we look for a logical place to do so next to the diagnosis of unstable angina, and we add it in a point where we know subsequent caregivers are likely to look. We can edit the text.
Now, Dr. Henry said something that's very important, where subsequent caregivers will know to look. Always, it's recommended that these comorbidities are inserted into the electronic medical record in the appropriate spot, so not only can subsequent caregivers, but so can the entire CDI team know where all these comorbidities and other diagnoses are placed. Here, the comorbidities that are going to be placed in the chart are the three that you see listed on your screen right now: hypernatremia, hypertension, and first-degree AV block. And next to each one of those, you see the rule that is used to identify this as a comorbidity, and that will be placed in the electronic health record as well. Let's hear from Dr. Henry.
We believe it should be done, and we incorporate it in the record, sign and submit.